High-efficiency treatments. For treatment. According to many studies, it is found that if a person with back pain due to spinal cord degeneration is detected early and from the beginning, she will be treated by physiotherapy quickly and minimize the risk of complications. The risks of spine later than those who did not treat the disease or used drugs only to treat the spine disease. There are many ways to treat back pain, such as drug treatment, oral medications, anti-inflammatory drugs, analgesic, muscle relaxants. Injection lubricates joints, the traditional medicine of Oriental medicine. Non-pharmacological treatment. Physiotherapy, stretching of the lumbar spine, shortwave, ultrasound, drug electrolyte. Exercises to support the back, lumbar can be done at home. Reflexology, massage, acupuncture. All of the above measures are intended to support the prompt, long-term and effective back pain treatment process. Private physical treatment method. For treating pain with two basic methods: electricity therapy, shortwave, ultrasound, drug electrolyte, etc. Therapy exercises to support the back, waist. In this article, we will provide exercises to support the treatment of back pain by restoring the balance of the skeletal system, muscles and ligaments, while also helping to stretch the spine, creating space between the vertebrae, and limiting the harm of bone spikes to nerves and spinal cord very effectively. Spend at least 5 minutes in the bank of your time to perform these exercises to help you really healthy and against the back pain due to spine that plague you every day. With this exercise you have to perform on a bed with a moderate pillow to raise your head, always breathe evenly and mentally to start practicing. Action 1. Lie on the bed with your arms and legs stretched out, take a deep breath while pulling your left knee close to your stomach, your hands holding your left knee. Head. Repeat with the other leg and do it about 10 times on each side. Action 2. Lying down, take a deep breath and pull your knees up to your stomach. Charge, hold your knees in your arms to hold for 10 seconds. Then release your hands and slowly lower your legs to stretch. Repeat this action 15 to 20 times a day. Action 3. Still performing the same as the second movement, but two hands. Do not hug two knees but place the palms on the top of the knees so that the arms and elbows curled into a square root. Hold for a few seconds and then lower. Continue doing about 10 times. Action 4. Pull your left knee to your abdomen as close as possible, and use your right hand to hug your left knee. Keep your other hand and leg straight, count from 1 to 5 and switch sides. Repeat the bouncing motion about 20 times. Action 5. Lying upright, arms stretched out to hip, with knees up so that the feet rest on the bed surface. Using two hands, 2 feet to support the whole push from the hips, back up from the bed to keep about 5s to lower and repeat. Perform about 15 to 20 times. Action 6. To perform this movement need lining carpet to avoid injury during training. Kneel and put your hands on the floor so that your back is straight and parallel to the floor. Raise your right hand forward and your left leg stretches out back with the back into a straight line. Hold the pose for 10 seconds, then slowly return to the starting position. Do the opposite with the opposite. Raise your left hand and right leg 10 to 20 times. Action 7. Preparing posture. As in step 6, the patient kneels and hands on the mat, then gently bends his back to the position the cat holds for 15 seconds and then returns to the original position. Perform 10 to 15 times. Action 8. Lie on your back on a flat surface, 2 hands relaxed to the sides, the legs are also straightened and relaxed. Next, the patient lifts up the legs in a circle like a bicycle, pedal like about 15 laps, then take a break for 30 seconds and then continue, doing it about 10 times. Action 9. The patient lies on his back, bends his knees 2 feet and 2 right soles of the feet to touch the ground. 2 arms outstretched by shoulders, palms and arms facing the floor. The patient then slowly pushes the buttock off the ground and holds it for 10 seconds before stopping back to its original position. Perform 10 to 20 times. This action helps strengthen the back muscles, reduce pressure on the damaged spine. Action 10. We sit like a kneeling posture, the knees kneel to the floor, the buttocks rest on the heels. Slowly lower your head to the floor at the same time, 2 arms close together, and slide the floor facing forward. The body slowly pushes forward, causing the back muscles to expand, sliding forward to the level that the body can withstand. It remains in place for 15 seconds, then returns to the original position. The above is to share about 10 exercises to support the treatment of back pain caused by spinal degeneration extremely effectively that many patients have successfully applied.